Welcome back to Psych Waves, where we review emerging and current topics in psychiatry while learning to better understand the workings of our own minds. I'm your host, Dr. Teresa Anderson, owner and practicing psychiatrist of the Anderson Clinic in Cincinnati, Ohio. So, in honor of September being Suicide Prevention and Awareness Month, we're tackling a topic that many of us find relatively uncomfortable, but one that we absolutely must talk about. As a psychiatrist, it's a topic that is near and dear to my heart and something that I discuss on pretty much a nearly daily basis. But for my non-mental health friends out there, it's time to empower you, our listeners, friends, family members, and colleagues to be a part of the solution. Not just because conversations save lives, but because things we don't talk about become taboo. And when it comes to suicide, that taboo can have deadly consequences. So let's break it down. We're going to cover 3 key things today: how to recognize the warning signs in someone you care about, how to start the conversation and bring it up because it can definitely feel awkward, and how to respond whether they are or aren't suicidal. First, let's talk about the warning signs. Now, I want to be clear, these are not a checklist to diagnose someone. This talk is for educational purposes only. It's to inform and empower. Think of these actions or behaviors as red flags. If you see one, be on alert. If you see several of them together, or there's a significant change in a person's behavior over a short period of time, it's a signal to pay closer attention and possibly intervene. These signs can be broken down into 4 categories: talk, behavior, mood, and history. So, first up, what are they talking about? Listen for direct or indirect statements. These might include things like, I wish I could just disappear, or my family might be better off without me. I can't take this pain anymore. You won't have to worry about me much longer. Or they might even talk about feeling trapped or being a burden to others. Behavior. Look for significant shifts. They might start withdrawing from friends, family, and activities they used to enjoy. They might be giving away or selling prized possessions. They might be saying goodbye to people as if it's the last time, or telling people in their lives how important they are to them, that your friendship has meant so much to me, or things like that, when they aren't typically emotionally effusive or even appreciative. If there's an increase in substance use like drinking or drugs, or a sudden inexplicable shift from being very sad and stressed for a long period of time to being very calm or even happy, that can sometimes mean that they've made their peace with a decision. So for mood, changes in mood are huge. I want you to be on the lookout for extreme mood swings, hopelessness, and a sense of feeling trapped, uncontrolled rage or irritability, and of course, obviously, severe depression or anxiety. I know this is a lot to take in, but remember, the key is to notice a change in their baseline. If your usually social butterfly friend starts to isolate themselves, or your optimistic colleague seems hopeless, that's your cue to lean in. History is a pretty complex topic, but certain things definitely increase the risk. And the biggest one, obviously, is mental health conditions. Things like depression, anxiety, or bipolar disorder, PTSD, especially if they're untreated or poorly managed. Other factors include current or past trauma or abuse, substance use, because alcohol and drugs can impair your judgment, worsen your mood, and sort of turn off that filter of, well, maybe this isn't such a bad idea. Major life stressors like divorce, job loss, fear of losing one's job or spouse from a chronic illness or health condition, or death of a loved one or pet. Chronic pain or illness in the person themselves, obviously, because it takes up a lot of brain space. It's hard to think about anything else when that's always on your mind. And previous suicide attempts are a significant risk factor. Now, past behavior doesn't dictate future behavior, as I always say, but it's a damn good predictor. Unfortunately, also, family history of suicide can play a role. Even the suicide of a close friend can, on some level, almost grant the person a sort of unconscious permission to relieve themselves of pain in this way, especially if suicide has been on their minds. So if you've noticed one or more of these signs, now comes the hard part, bringing it up. You might be thinking, what if I put the idea in their head? That's actually a common myth, and it's simply not true. Much like talking to your teens about sex doesn't put the idea into their heads. Hormones, peer pressure, and social media did that long before you did. And study after study shows that asking someone directly about suicide does not increase the risk. As a matter of fact, it often provides a sense of relief, a signal that someone finally sees their pain. A taboo only exists if we don't talk about it. It increases in power, and pain only if we don't talk about it. And the likelihood of something bad happening only increases if we don't talk about it. Notice that. Yes, please. So, how do you do it? First, make sure that you're in a private space. Make sure that you are direct but kind, and you want to use a calm and non-judgmental tone. Start by expressing your care and concern for them. You could say something along the lines of, "Hey, I noticed you haven't really been yourself lately, and I'm really concerned about you." Or, "I haven't seen you around the gym, our favorite coffee shop, or even work much lately." Or, "I've been worried about you. I wanted to check in. How are you doing?" After you've opened the door, be direct. And here are a few ways to phrase it. "Are you actually thinking about suicide? I'm worried about you. Are you having thoughts of hurting yourself?" Sometimes when people are going through what you're going through, they think about ending their life. Have you had those types of thoughts? You might feel your heart racing just thinking about saying those words, and that's okay. It's a brave and loving thing to do. The most important thing is to create a safe space for them to be honest with you. So, how do we respond once we do ask the question and they answer yes or no? This is where you can become a lifeline. Scenario A is they say, "Yes, I actually have been thinking about suicide or hurting myself." Take a deep breath, folks. This is the moment to remain calm. Your job is not to solve their problems or become their psychiatrist, but to keep them safe in this moment. Don't react. Don't try to talk them out of it. Don't tell them they have so much to live for or negate what they're experiencing. This is your own protectiveness and defensiveness talking. First things first is you thank them for their honesty. "Thank you so much for telling me. That took incredible courage." Ask them if they have a plan. This is critical. Have you thought about how you might do it? If they say yes and they have access to means like a weapon or massive amounts of unsafe medication, this is a very high risk situation. Do not leave them alone. If possible, stay with them. If not, get them to a safe place with someone else. You don't want to be alone in this situation. Even if you think you will be safe, even driving to the nearest emergency room can become a life-threatening proposition if they are actively wanting to die. You want to get them professional help immediately. This is not something you have to handle on your own. You can call the National Suicide Prevention Lifeline at 988, and this is okay in both US and Canada. And if they are not available or something doesn't go through, typically call 911, obviously, if you feel like they're in immediate danger. So, scenario B, you gathered the courage to ask the question and they say, "No, I'm not thinking about suicide." That's wonderful news, but your job actually isn't over. Thank them for their honesty and even say, "I'm so relieved to hear that. Thank you for being open with me." You want to validate their pain. You don't say, "Oh, good, everything's fine then," and go on to another topic. No. Instead, say, "Even if you're not thinking about that, I can tell you're still in a lot of pain. I just want to let you know I'm here for you and I want to help if I can." Offer support. "Let's grab a cup of coffee next week." Or, "I'm here to listen whenever you need to talk." Encourage them to seek help from a professional. Obviously, a doctor or therapist would be good, but if they don't, regular check-ins are also good. You want to actually be a little annoying and almost forceful here. A lot of folks, especially the ones suffering from depression, don't want to be a burden on someone else. Set up a daily text or phone check-in and try to do something social at least once a week. Why? One, because they could still be suffering, and two, they may not have been entirely honest with you about not being suicidal and trying to throw you off the trail. Or three, maybe they're not suicidal now, but could be in the very near future. They might have felt surprised or defensive about the fact that you asked, or may not have yet felt comfortable with sharing that information with you, or sharing it with anyone for that matter. In both scenarios, the most powerful thing you can do is listen without judgment. Don't say things like, "Oh, but you have so much to live for," or "Look on the bright side." That can minimize their pain. They don't feel heard. And it's essentially engaging in toxic positivity. It's ignoring their current reality. Just listen. Just let them know you hear them. And so, for what it's worth, suicide is not a character flaw. It's a mental health crisis. It's not a judgment. It doesn't mean that they're weak. They are overwhelmed by life circumstances and likely very crappy neurochemistry. Some of the coolest people I know have made it through the worst times imaginable and lived to tell the tale. They're also some of the most kindest, courageous, most resilient people I know. Why? Because they know that life can break you down, but they didn't let it. And because they didn't, they are leading by example. By educating ourselves and having the courage to speak up, the courage to dissolve the taboo, we can change the narrative and hopefully even the outcome. We can replace silence with conversation and despair with hope. So if you or someone you know is in crisis, please call or text 988 anytime, 24/7 in the United States and Canada. In the UK, I believe you can call 111. These are free, confidential resources that can provide immediate support. In both cases, listen without judgment. Your presence, your willingness to listen, and believe it or not, your directness can be life-saving. Don't not ask the question because you could be embarrassed. You will never regret asking, and you'll get over the embarrassment a lot faster than you will their loss. Thank you for listening today and being a part of the mental health conversation. Let's make this September a month where we commit to being a little more courageous, a little more compassionate, a little more aware, and a lot more vocal. No more taboos. Until next time, this has been Dr. Teresa Anderson on Psych Waves. If you found this information helpful, please like and subscribe. Follow us. Tell your friends. Follow our podcast Psych Waves on Apple and Spotify or Instagram and TikTok. We are at Anderson Clinic Cincy with a Y. And if you happen to be in the Cincinnati area or looking for assistance with treatment-resistant depression, anxiety, PTSD, or concussions, please give us a call at 513-321-1753, or you can stalk us online at www.andersonclinic.net. Start feeling better faster.